Here's a graph of developed countries. This is the United States compared to everybody else, what we spend on healthcare per capita. And it doesn't necessarily mean that we have better care, right? I mean, the quality of the care, we can argue in places like England, France, Germany, they have pretty darn good healthcare in those countries. We can also see that, compared to the rest of our economy, and I need to up, this slide is about 5 years old now. So compared to the rest of our GDP, the rest of our economy, healthcare costs are always increasing at a higher rate. Why is that? So kind of boiled this down to two major issues. One of them is that we have very complicated processes for everything in our healthcare system here in the United States. And I would blame the insurance company for this, for much of it. I like to use the example of ordering an MRI. So as a family medicine doc, I see a patient in clinic for low back pain. He's got radicular pain. I think, okay, let's get an MRI of your spine. So I put the order into the computer. Someone on my staff sends that through to the insurance. The insurance comes back and sends a prior authorization or pre-certification. I fill that out. I send it back. This is if I'm an insurance-based doctor in the system. I send that prior authorization back. Someone on the insurance side reviews it. They come back, they deny the claim, they want a doc to doc. I have to call and talk to a doctor on the phone who has never seen the patient or touched them and kind of debate with them whether or not they actually need this MRI done. Then finally, maybe they approve it, maybe they don't approve it. So there's a cost associated with that process. There's time and money and all the people that have had to touch that claim. Let's compare that to in the direct primary care environment that I work in now. If I have a patient in the office that needs an MRI done, I put that order into the computer. My staff faxes the order form to the MRI facility. They call and schedule the patient. They have it done in the same day sometimes, not weeks later, not months later. We can look at the legislative acts that have happened over the last 20 years, or even longer, DRGs in the early 80s, which were part of how physicians are paid. And then you have the HIPAA Act that passed in the 90s, and then especially the HITECH Act that passed in 2009, which required physicians to use electronic medical records. And all of these times, it has increased the number of healthcare administrators. So this red line is healthcare administration growth versus physician growth. So, all of these people have to get paid, but they don't actually have any direct patient care. They aren't touching the patient, they aren't taking care of the patient. But there is a cost associated with this. And so I think it's just important to point out kind of where that is going.